Hi, my name is Callie Grace Tucker. I work with the University of Tennessee, Knoxville and UT Medical Center, and we're evaluating the implementation of the Eat, Sleep, Console method for treating neonatal opioid withdrawal syndrome, also known as NOWS. This was important for us to evaluate because our infants that struggle with NOWS face increased length of stay at hospital and are a greater need for pharmacologic treatment, which both increase healthcare delivery costs and affect neonatal outcomes. The original way for evaluating NOWS was using the Finnegan neonatal abstinence scoring tool, which evaluated their withdrawal symptoms rather than the functionality. In 2019, our institution moved to adopting the Eat, Sleep, Console method, which simply looks at is the infant sleeping, eating, or consoling within 10 minutes. And we are trying to use this project to evaluate its implementation currently on the Well Baby unit and recognize our own strategies for improvement. We started with a gap analysis. We looked into the literature to find the evidence-based practices of Eat, Sleep, Console, and then we administered two surveys, one to the Well Baby unit nursing staff and another to neonatology providers. We looked to assess provider perceptions, staff confidence, patient preparedness, our current adherence, and known barriers, all within Eat, Sleep, Console. We categorized all of the responses into different groups, like I said before, and we averaged those responses and standardized them to find a percent of optimal practice with both staff groups. We then asked each staff member to identify barriers that were inhibiting their Eat Sleep Console implementation by choosing from a list. The biggest conclusion and result that we found was that the answers were different based on team member roles. So the largest difference, as you saw before, was the perceived effectiveness of the Eat Sleep Console, which reflected a knowledge gap at our institution, specifically with the nursing staff between that step to neonatal providers. And we had similar barriers reported, meaning a lack of staffing, low caregiver capacity to be involved, and inconsistent escalation pathways for when infants fail. We're working with the neonatal transition work group to make a more comprehensive nurse education on Eat Sleep Console so that we can understand how to best implement it at our hospital and reaffirm those evidence-based practice that makes the best procedures. We want to make clear policies regarding escalation of care and clarify documentation processes for all standardized treatment. And finally, we want to provide detailed materials to prepare both staff and patients so that they're prepared when they go in to educate the patient, and then the patients can feel confident when they're discharged from the hospital. Thank you for listening.